That's okay. Her cheeks gonna pay as soon as Ivy gets on her trail. She's aware, and has been aware for years. Maybe she's given her a kickback at it.
Good afternoon. This afternoon, the Committee of the Whole is holding a public roundtable on PR 14-171, compensation agreement between the Commission on Mental Health Services and the District of Columbia Nurses Associations Union Approval Resolution of 2001. PR 14-171 provides for council approval of the compensation agreement between the Commission of Mental Health Services and the District of Columbia Nurses Association covering registered nurses at the newly created Department of Mental Health for fiscal years 1999, 2000, 2001. We will begin the roundtable with Martha Valdez, Chair of the DC Nurses Association, Commission on Mental Health Unit Services.
Hi, good afternoon, Chairperson Kropp and members of the committee. My name is Martha Valdez, and I'm speaking today as Chairperson of the District of Columbia Nurses Association of the Commission on Mental Health. I have had the privilege of providing care to persons with impairments at St. Elizabeth's Hospital for 29 years. I have given testimony to the Council to advocate for the Commission's patients and on behalf of the 250-plus nurses who provide 24 hours of care 365 days a year. DCNA and the Commission on Mental Health Service Management have reached an agreement on compensation packages for registered nurses. We urge the Council to act immediately to pass this legislation since the nurses have not had a pay increase since 1996. How appropriate that the Council is considering this compensation package during Nurses Week. A recent study by the Health Resources and Service Administration report on a nationwide nursing shortage. As nurses are faced with mandatory overtime, violence, and increasing patient-staff ratios to cover for the shortage of staff, they are leaving this profession to choose other professions. According to the law, a truck driver is not permitted to drive more than 10 hours straight because of the safety issue, and an airline pilot is not allowed to fly more than 14 hours at a time. How is it that nurses who handle potentially dangerous patients and medications are allowed to work shifts of 16 hours or more? Psychiatric mental health nurses make only 3% of all nurses who graduate from nursing school. These professionals are the heart, the backbone of mental health care and play an indispensable role in providing services. In psychiatric care, our patients can become violent without notice, and occasionally even friends or family members of the patient can become a threat to the staff. Nurses use our training and skill to listen and respond by care, connect with the patient holistically as a person, appreciate the patient's situation, respond to the patient's needs, and empower the patient to become an active participant in health care. Oftentimes, it is our job to educate a patient who is schizophrenic, not only on his psychiatric medicine, but also on the medical medicine, like giving themselves an insulin syringe or encouraging an HIV patient who is dying to have a reason to live. Nurses within the Commission have continued to be dedicated to providing quality care in a supportive, compassionate manner. We are known for innovative patient services, and our commitment to excellence has continued despite downsizing, shortage of staff, supplies, and a very lengthy wait for an agreement on a compensation package. As the CMHS nurses are willing to assist district citizens in receiving quality, accessible, and compassionate health care, we implore the Council to pass this legislation for nurses who continue to be a consistent and stabilizing force for the patients we care for. We know that the committee is dealing with many other priorities facing the district government. We appreciate your speedy action in scheduling this roundtable, and we look forward to a favorable vote on PR 14-171 at the next committee and legislation. I would like to introduce you to Woodrow Wilson, and he also would like to give a short testimony. Thank you.
Thank you.
Good afternoon, Madam Chair. My name is Winslow Woodland, and and I work as a registered nurse for the Commission on Mental Health Services in its acute psychiatric hospital. I also serve as Chief Shop Steward for the District of Columbia Nurses Association, the same union that represents nurses at the Washington Hospital Center, Howard University Hospital, Greater Southeast Community, Children's Hospital, Columbia Hospital for Women, and the District of Columbia Department of Health, as well as those working with what is left to be the Public Benefits Corporation. I'm often disheartened by the lack of respect that nurses are given. As a nurse working with clients, I feel at times frustrated by the present state of affairs. Clients are being admitted as frequently as they were when I began working for the Commission on Mental Health Services in 1994. Many are admitted for the first time. Others repeatedly come and go. Non-compliance with outpatient treatment seems to be the major reason for readmission due to the lack of adequate follow-up care stemming from the lack of staffing and many clients' unwillingness to participate. Nursing staff of the CMHS are an integral part of the daily delivery of care. They ensure clients have meals, clean clothing, medication, groups, protection from predatory individuals, and oftentimes serve as the only family that many clients know. Inpatient care is, for the most part, on locked wards and requires patience, skill, tact, and consistency. Nursing staff are responsible for ensuring clients are cared for in a respectful, humane, and safe environment. Every need must be met with the assistance of nursing staff. Outpatient care on paper is comprehensive and dynamic. Reality places staff at a disadvantage. RNs are assigned in roles that require them to administer medication, locate housing, and occasionally confront hazards similar to police officers. Inpatient and outpatient nurses are faced with an increasingly violent client, and many sustain injuries comparable to football players, boxers, and street fighters. Earlier this year, I was scratched in 4 areas of my face, leaving scars that may be permanent. My only reward is that I did not harm the client and know that the injury could have damaged my eye, but didn't. Bravely, boldly, and with perseverance, RNs for the Commission carry out their duties. Consider this. RNs are considered essential employees, requiring them to sign a statement that they will make every effort to get to work during weather emergencies. Most other government employees are not required to work or placed on liberal leave status. RNs are not allowed to take early outs, although they are often offered to other Commission on Mental Health Service employees, with the reasoning being that RNs leaving would create a staffing crisis for the agency. The lack of RNs was cited as a primary reason that the Healthcare Finance Administration failed to accredit the agency in the past. Somehow, the Commission was able to convince HCFA that things have improved, but the staffing situation looks virtually the same to RNs on the job. This clearly suggests to us that the RNs currently employed are working beyond what is expected from other hospitals. RNs are forced to work overtime when staffing coverage is not adequate, which can put the clinician and the client in jeopardy. The DC Code 1-621.61 through 1-621.63 is specific to Commission on Mental Health Service employees and cites certain CMHS employees at a high risk for illegal substance and alcohol abuse. In the definitions, it states, and I quote, "High potential risk employees means any department or commission employee who has resident care or custody responsibilities in a secured facility or who works in a residential facility." Most of the RNs at the CMHS work in such conditions and do not abuse illegal substances or alcohol. The fact that this code exists suggests that it is known that RNs work under stressful conditions. It appears on the one hand that CMHS RNs are essential components of the delivery of mental health services for the District of Columbia citizenry. On the other hand, they have not been considered worthy of timely, fair, and just consideration when it comes to benefits and compensation. The Commission on Mental Health Services, the District of Columbia public mental health provider, is facing sweeping changes. The agency is just now leaving court receivership and has been mandated by law to provide care to clients in the least restrictive means possible. Employees working for the CMHS have been bracing for the changes, as many will be affected. The constantly changing CMHS leadership has been aware of all the above circumstances, yet RNs have not had an increase in salary or benefits since 1996, the year their contract expires. The RN union, DCNA, and its negotiating team have been involved in negotiating with management requiring the intervention of an outside arbitrator. All outstanding issues were settled in August 2000. To date, RNs still do not have an approved contract in force. There is, once again, new leadership and new structure at the highest level of management. The receiver, Dennis Jones, has developed a plan that is the blueprint for the new mental health delivery system. He has held briefings with stakeholders to include clients, mental health advocacy groups, labor unions, community activists, and the appropriate government officials. DCNA has been working to forge a true labor management partnership, and it's in the interest of representing employees and improving the services delivered to our clients. Without a competent, sufficient staff of registered nurses, none of the grandest or simplest of plans to improve or even maintain the current delivery of mental health care to the citizens of the District of Columbia will be realized. The Council has an opportunity to take real action in this regard. By approving the CMHS DCNA compensation agreement, you will be sending a message to nurses that our work is respected and appreciated. You will assist in keeping good nurses from leaving the system for positions that offer higher pay, greater safety, and better working conditions. In addition, you will help us recruit new nurses, which is very difficult in a climate where other employers are offering higher salaries, thousands of dollars in sign-on bonuses, flexible scheduling, and other perks that are currently unavailable in a public sector setting. We urge you to act quickly to approve our compensation agreement. We have been waiting for a long time. On behalf of the nurses at the CMHS, I thank you for your interest and attention to our concerns.
Thank you, Councilwoman Crock. We appreciate this being placed on the agenda today. Winslow and I very much thank you for this.
Thank you. Stay there for one moment, Ms. Valdez and Mr. Woodland. I have just a couple of questions. The nurses have not received compensation increase since '96.
Yes, ma'am.
And Mr. Woodland, in your testimony, you went on as to it's taken a long time. What were the issues? What took so long?
Well, from my understanding of the process, it's lengthy in nature, and that when an issue is disputed between management and the negotiating team, usually they have to give something or we have to give something to meet in the middle on issues. There were several issues that were hard to get over. One being the nurses frequently work in buildings and other situations that put their health at risk. And we wanted, for example, to be able to take the issue beyond the current procedure in terms of getting the situation rectified. Management was not willing to bite on that issue. We also wanted the ability to be able to have a clause in our contract that successorship would be in place for any future employer that came in and would, with the court order and the systems changing, if a private company were to take over the commission, we just wanted our contract honored so that, salary and benefits and such would still exist. There were several other issues that kept the process locked up for years, and I can't recall all of them right now, but those are two of the most prominent.
One of the problems initially was the separation when we became under a receivership, that we had to separate from the district government into the receivership, and we had to negotiate with the receiver. That started the whole negotiation process all over again.